You're going to talk about the bones of the skull. The human skull consists of about 22 to 30 single bones which are mostly connected together by ossified joints, called sutures. Its main task is the protection of the most important organ in the human body, the brain. The aim of this tutorial is to elaborate on the bones that make up the skull. The skull is divided into the brain case, known as the neurocranium, which consists of the skull cap, known as the calvarium, and the skull base, as well as the face, which is known as the viscerocranium. Let's break down the features of the brain case first. We are looking now at the superior view of the skull. This is the skull cap, which is made up of the pairs of parietal bones and parts of the frontal bone, as well as the occipital bone. The coronal suture, the sagittal suture, and the lambdoidal suture separate these bones and are the three most significant of all 33 sutures which are formed by the human skull bones. The base of the skull is the caudal boundary of the cerebral cranium. Looking at it from the inside, it can be subdivided into the anterior, middle, and posterior cranial fossae. Looking at it from the outside, or inferiorly, the base of the skull is comprised of several bones, including the sphenoid, occipital, and temporal bones, maxilla, and zygomatic bone. Moving on to the face, it consists of all skull bones frontocaudally connected to the neurocranium. Prominent representatives are the maxilla, the upper jaw, and the mandible, the lower jaw. The orbit and the nasal cavity are formed by the zygomatic bone, the nasal bone, the palatine bone, the lacrimal bones, the vomer, and the inferior nasal concha.